Pulmonary fibrosis is a condition that affects the lungs and can have a significant impact on one's quality of life. It is characterized by the scarring and thickening of lung tissue, which can lead to difficulty breathing and decreased lung function. To manage pulmonary fibrosis effectively, it is important to be mindful of the foods you consume. Certain foods can exacerbate symptoms and make it harder for your lungs to function optimally. In this video, we will show you 10 foods to avoid if you have pulmonary fibrosis. Before we continue with the list, make sure to subscribe to Healthy Lab and turn on the notification bell so you won't miss any of our new videos. Every subscriber is much appreciated. So, let's start. 10. Cookies. One of the main reasons why eating cookies can be problematic for individuals with pulmonary fibrosis is their high sugar content. Cookies are often loaded with refined sugars, which can lead to inflammation and oxidative stress in the body. Inflammation is known to play a significant role in the development and progression of several chronic diseases, including pulmonary fibrosis. By exacerbating inflammation, consuming cookies may worsen the symptoms of this respiratory condition, making breathing even more challenging. Another crucial aspect to consider is the impact of cookies on weight gain. Many cookies are high in calories and unhealthy fats, which can contribute to weight gain and obesity. Weight gain has been linked to reduced lung function, making it more difficult for individuals with pulmonary fibrosis to breathe properly. 9. Pickles. Eating pickles is a popular pastime for many people around the world. Whether it's enjoying them as a snack, topping a burger, or adding them to a sandwich, pickles have become a staple in many diets. However, for individuals with pulmonary fibrosis, indulging in this tangy treat may not be the best choice. One of the key reasons why consuming pickles might be problematic for individuals with pulmonary fibrosis is the high sodium content. Pickles, being traditionally made by fermenting cucumbers in a solution of vinegar, water, and salt, tend to be brimming with sodium. Excessive sodium intake can lead to fluid retention, which can further strain the already compromised lungs of those living with pulmonary fibrosis. Furthermore, it can lead to high blood pressure, which can increase the workload on the heart and lungs, making breathing even harder. 8. Peppers. Peppers, known for their vibrant colors and spicy flavors, are a popular ingredient in many cuisines around the world. However, for individuals with pulmonary fibrosis, consuming peppers can be detrimental to their respiratory health. Peppers contain a compound called capsaicin, which is responsible for their heat. While capsaicin can provide certain health benefits for the general population, such as pain relief and improved metabolism, it can be problematic for individuals with pulmonary fibrosis. Research suggests that capsaicin can trigger a series of reactions in the body, including the release of substance P, a neuropeptide that plays a role in inflammation. Inflammation is a major driver of lung damage in pulmonary fibrosis patients, as it can lead to the formation of scar tissue and further compromise respiratory function. By consuming peppers, individuals with pulmonary fibrosis may unknowingly exacerbate this inflammation and worsen their symptoms. 7. Pizza. Consuming pizza is often seen as a delicious and indulgent treat. However, for individuals living with pulmonary fibrosis, it's important to be mindful of certain dietary choices. One of the primary concerns with consuming pizza, particularly those from fast food chains or heavily processed varieties, is its high sodium content. Sodium is known to cause fluid retention and can lead to increased blood pressure, making it more difficult for individuals with pulmonary fibrosis to breathe comfortably. Excess sodium intake can also contribute to the development of edema, a condition characterized by the accumulation of fluid in the body, including the lungs. Another aspect of pizza that can be detrimental is the presence of processed meats and additives. Many pizzas are topped with cured meats such as pepperoni, sausage, or bacon, which often contain nitrates and nitrites. These chemicals have been associated with increased inflammation in the body, which can worsen lung symptoms and potentially contribute to the progression of pulmonary fibrosis. 6. Tomatoes. Eating tomatoes has long been considered a healthy dietary choice due to their rich nutrient content and potential health benefits. However, for individuals suffering from pulmonary fibrosis, the consumption of tomatoes may have some negative implications. They are naturally high in histamines, which are compounds involved in the immune response and allergic reactions. In individuals with pulmonary fibrosis, the presence of histamines can lead to an increase in inflammation and mucus production in the lungs, further compromising respiratory function. This can worsen symptoms such as coughing, wheezing, and shortness of breath. Another aspect that researchers are exploring is the acidic nature of tomatoes. Some studies suggest that the acid in tomatoes might irritate the already compromised lung tissue, leading to increased coughing, wheezing, and shortness of breath. 5. Soda. Drinking soda has become a popular habit for many people around the world. It's a refreshing beverage that quenches our thirst and provides a temporary burst of energy. However, when it comes to our health, soda consumption can have detrimental effects, particularly for individuals with pulmonary fibrosis. Firstly, the high sugar content in soda can contribute to weight gain and obesity. Excess weight puts added pressure on the lungs, making it even harder to breathe. Additionally, obesity is linked to inflammation in the body, which can further worsen lung function and increase the risk of complications. Furthermore, soda contains phosphoric acid, which is known to interfere with calcium absorption in the body. Calcium plays a crucial role in maintaining healthy lung function. When calcium levels are disrupted, it can lead to weakened lung tissues and decreased lung capacity, making breathing more challenging for individuals with pulmonary fibrosis. 4. Coffee. While the causes of pulmonary fibrosis are complex and multifactorial, recent studies have suggested a potential link between drinking coffee and the progression of this condition. Coffee is naturally acidic, and excessive consumption of acidic beverages can potentially worsen symptoms. Acidic substances, including coffee, can irritate the already inflamed and scarred lung tissues, leading to increased coughing, shortness of breath, and discomfort. Individuals with pulmonary fibrosis must maintain a balanced pH level in their bodies, and excessive coffee intake can disrupt this delicate equilibrium. One of the primary components of coffee is caffeine, a stimulant that affects the central nervous system. While caffeine provides a temporary energy boost for most people, it can exacerbate breathlessness in individuals with pulmonary fibrosis. The increased heart rate and stimulation caused by caffeine can lead to shortness of breath and heightened discomfort for those already struggling with breathing difficulties. 3. French fries. Eating French fries, a popular and delicious snack, may seem harmless on the surface. However, for individuals with pulmonary fibrosis, indulging in this tasty treat can have negative consequences. French fries are typically deep-fried in oil, resulting in a significant amount of saturated and trans fats. These fats can increase inflammation in the body, which is particularly concerning for individuals with pulmonary fibrosis. Inflammation can further damage the already compromised lung tissue, making it even harder for the lungs to function efficiently. Additionally, French fries are made from white potatoes, which are high on the glycemic index. Foods with a high glycemic index can cause a rapid rise in blood sugar levels. This sudden spike in blood sugar can lead to systemic inflammation, which can worsen the symptoms of pulmonary fibrosis. Individuals with this condition often have weakened immune systems, and the added inflammation can further compromise their lung health. 2. Lemons. While lemons are packed with vitamin C, which is known for its antioxidant properties and its ability to boost the immune system, they are also highly acidic. The high acidity of lemons can potentially exacerbate certain symptoms associated with pulmonary fibrosis. Acidic foods can trigger acid reflux or heartburn, which can cause discomfort and further irritate the already compromised lungs. In addition to the acidity of lemons, citrus fruits also contain a compound called limonene. Limonene is responsible for the characteristic aroma and flavor of lemons but can also be a respiratory irritant for some individuals. In the case of pulmonary fibrosis, consuming foods that may further irritate the respiratory system is generally not recommended. Moreover, lemons have been known to trigger coughing in some people, particularly those with sensitive airways. The acidic nature of lemons can irritate the throat and air passages, leading to increased coughing and potential discomfort for individuals with pulmonary fibrosis. 1. Alcohol. Drinking alcohol has become a common social activity for many people, but it is important to understand the potential negative effects it can have on our health. One specific condition that can be worsened by alcohol consumption is pulmonary fibrosis. Alcohol is known to increase inflammation throughout the body, including the lungs. When alcohol is consumed, it can trigger a cascade of inflammatory responses in the lungs, exacerbating the already existing inflammation associated with the disease. This can lead to further damage and scarring of the lung tissue, making breathing even more difficult for individuals with pulmonary fibrosis. Alcohol can also weaken the immune system, impairing its ability to fight off infections and diseases. People with pulmonary fibrosis are already more susceptible to respiratory infections, and alcohol can further compromise their immune response. In conclusion, managing pulmonary fibrosis effectively involves being mindful of the foods you consume. Certain foods can worsen symptoms and hinder lung function, so it is important to make choices that support optimal lung health. By avoiding these foods and opting for a balanced diet rich in nutrients, individuals with pulmonary fibrosis can improve their quality of life and effectively manage their condition. Thank you for watching, and we look forward to seeing you in the next video.